And as you said earlier, there are some things we can control and some things we can't. So we're just going to go to the next presentation, and let me welcome Raquel. Raquel Gonzales is an exercise physiologist at the Rehab Institute of Chicago, where she started in August of 2005. Among many other responsibilities, Raquel coordinates a cancer fitness program at RIC. She received a bachelor's degree in kinesiology from the University of Illinois at Urbana-Champaign and a master's in exercise science from Northeastern Illinois University. Welcome.
Thank you, Miriam. And thank you all for sticking around for this lovely talk of exercise. It's probably the last thing you want to think about. And I want to kind of just piggyback on what Chuck was saying earlier. You're not alone. There's definitely a lot of resources out there that are helpful for you and even your family and caregivers alike. And before we get into our discussion today, or our talk today, I want us all to start off with a little exercise, and we'll give you a little bit of meaning what really exercise is really about. And somebody had said earlier that exercise also means movement, and yes, I agree. And so let's get our blood flowing just a little bit before we leave today, okay? And just sit back, relax. You can close your eyes if you need to, if you'd like to. Let's drop your arms down at your sides. Relax those shoulders, right? Look up nice and tall. Have your feet flat on the ground. And I want you to take a deep breath in through your nose. Inhale. And exhale through your mouth. Inhale through your nose. And exhale through your mouth. This time, when we inhale, if you can, raise your arms. We'll raise your arms all the way up. Inhale, you can clasp your hands and pull towards the ceiling. Stretch that spine. And exhale and bring them down. Very good. Do that a couple more times. Bring your arms all the way up. Inhale. This time go even further towards the ceiling. And exhale, coming back down. Last one, even bigger if you can. Coming all the way up. Inhale and stretch, stretch, stretch. And exhale, coming down. Very good. And so believe it or not, these are a couple of different exercises. You are exercising and you are moving. And for some individuals, this might be just enough. For others, this just might be too light. But either way, it's a good way to prepare your body into going into a full exercise regimen. And at RIC, the Rehab Institute of Chicago Health and Fitness Center, we help to modify exercises based on your needs, especially if you're undergoing treatment or if you have any different kinds of side effects during your treatment. And what I do want to bring up is exercise for most people who are undergoing cancer treatment or even thereafter, because we also deal with long-term side effects, has taken a different meaning. And for us at RIC, exercise also means rehabilitation. Exercise is very important, not just during treatment or even after, but before, and prevention of injuries. So if you're used to playing a sport, baseball, you have that repetitive movement, right? You want to strengthen the shoulder, your back, your abdominals, your hips to help prevent any injuries from occurring. Or even when you're working, doing a particular task, maybe carrying boxes, lifting, or pushing things, you want to help strengthen those muscles around in your upper body to help prevent any injuries. But besides that, you also want to think about any secondary conditions, not only through cancer treatment, but also just in general for anyone else who does not have cancer. And that's what I mean is prevent any diabetes or cardiac disease, obesity for that rather. And if we do get a diagnosis such as cancer, we want to help to improve our functional abilities through maximizing what we're able to do through exercise or movement, or otherwise known as rehabilitation, which is quoted through Okay. And so here are a few people here on this list who may be a part of your rehabilitative team. You might not see everyone here, but depending on your specific case or situation or concerns. But this integrated team, each person plays a very important role in your rehabilitation. So you have your oncologist, the person we meet for medications and they give you different treatments for your cancer. Then you might see a physical therapist. So that's an individual who you may see if you've gone through a particular surgery, if you're dealing with severe pain, or if you have lymphedema. So some physical therapists have certifications or are certified to work with individuals who have lymphedema to better manage. Or you may have an occupational therapist who may help you to work on your daily life activities. So things such as using your hands to button your shirt, or raising your arm to comb your hair, or brushing your teeth, for instance. You might see a speech and language pathologist if you have any swallowing disorders, or if your speech has been affected. Or a rehabilitation nurse who you may see in the hospital and during your inpatient care. Registered dietitian, and we heard Mary speak earlier, to help maintain or find better ways to eat while you're undergoing treatment, or maybe even to help lose weight because of the steroids that you are taking as part of your medication. You might also see a psychological counselor, so for those who may be able to need a little help to cope with certain situations within the family, within your social groups, or within the disease itself. And a vocational rehab specialist, those are individuals who help you get trained to perform certain skills for a particular job or career. Right? And then last but not least, the exercise physiologist, those individuals who help you to continue on with improving your functional abilities and your fitness levels during and post-treatment to help improve your quality of life. And so these exercise physiologists, you may see them in different settings, such as clinical settings. You may see them performing exercise stress tests, more so particularly for individuals in cardiac care, or maybe pulmonary patients as well. And these individuals are certified through the American College of Sports Medicine. And this organization, I definitely want to highlight. Not all exercise physiologists are certified through this organization, but I wanted to highlight this one particularly because it is the largest sports medicine and exercise science organization in the world. And they really highlight and emphasize on scientific evidence-based research. And they go through education with the health fitness professionals and make sure that they understand what are the safe exercise guidelines to go through when working with someone with a physical disability or a chronic disease, for instance. And so, I'm sorry, I went back too much. Okay, I'm sorry. And so their motto is exercise is medicine. This is their statement, which means that it is a global health initiative that is focused on encouraging primary care physicians and other healthcare providers to include physical activity when designing treatment plans for patients and referring their patients to health fitness professionals. So their main idea was to go and help get the physicians connected and linked to exercise fitness professionals in order to help the patient maximize their fullest fitness potential. And so within this organization, there are several groups of experts that tailor certain pieces of education in regards to exercise in different populations, such as obesity, children and exercise, diabetes, pulmonary, cardiac disease, and cancer. And so specifically with cancer, they've come together to review scientific evidence on cancer survivorship and exercise. Why? Because in the past, there hasn't been any exercise guidelines that have been specific. So in the past, we've had physicians who have maybe let our patients know, well, you might want to just go home and preserve your energy. Or some physicians may have said, what would be a good thing to do is exercise and walk along the park, or maybe take some stairs instead of the elevators, which is a great recommendation to have. But sometimes I feel like when I have a client come in, they usually tell me and say, well, I don't know how much of that to do. I don't want to overdo it. I don't want to do too much, but I don't also want to not do enough to receive the exercise benefits. So the scientific evidence has grown exponentially for during and after cancer treatment. And there are exercise programs for cancer survivors, and they're beginning to proliferate. One of which is called the Restore Fitness Cancer Program at the Rehabilitation Institute of Chicago. And what we do is focus on helping the individuals to regain their functional level of ability and help them get back to before their pre-diagnosed levels, or even help to prevent any secondary conditions such as diabetes or cardiac disease. So there are definitely a long list of symptoms that are due to chemo, radiation, hormone therapy, and surgery, such as body weight changes, pain, peripheral neuropathy, and maybe even develop through some of the steroids that may be taken, cognitive changes, lymphedema, gastrointestinal damage. But what is the research saying about all of this? So there are definitely these side effects that say that, well, these side effects have improved because of the exercise. For instance, if you had side effects such as low blood cell count, exercise is said to stimulate your red blood cells. Right? And what if you had cachexia, that's muscle atrophy, and increased body fat mass? Exercise is said to increase protein production, muscle regeneration, and fat breakdown. Another side effect would be decreased flexibility and range of motion. So, for instance, if you've had or have breast cancer and you're taking aromatase inhibitors, this may create some stiffness around the shoulders, around your knees, your wrists, your ankles, your joints. And exercise has said to improve in connective tissue integrity and your range of motion. So there's tons of studies, particularly in this area, where breast cancer survivors had participated in warm water exercise programs and have felt less pain and improved range of motion through the joints. And how about increased necrosis and cellular debris? Exercise has gotten down even to the cellular level of the physiology of the individual. It's said to improve the removal of toxicities. And decreased energy production, delivery, and utilization. Exercise is said to improve carbohydrate, fat, protein breakdown, which is definitely very important for the utilization of energy. And cardiotoxicity. So some of the treatments that you have through, let's say, chemotherapy may affect us, and exercise has improved cardiovascular efficiency. So it helps for your stroke volume to increase, the amount of blood that's pumped out through your heart. And of course, we talked about earlier about depression and anxiety. There are different, many things to try to help cope with this, as we talked about earlier, through social work and maybe even with some of our psychologists here. The exercise has also been another resource to help improve your confidence, your body image, and decrease the stress and sleeplessness. And decreased immune function, exercise has said to help increase your white blood cell count. And of course, fatigue is one of the most detrimental side effects that we encounter with cancer survivors. But exercise has improved fatigue and improved your physical and psychological well-being. So how about some of the research? So some of the research has evaluated or assessed the efficacy of exercise programs. And ACSM has definitely gathered some of this to educate health fitness professionals. And they talk about cardiorespiratory fitness. That's how long you're able to endure a certain task, whether it be walking, going up and down stairs, or do a repetitive motion at your job. Strength, for instance, to lift and carry a box, or push a door open, or pull a door open, getting up from your chair. Physical function usually involves both cardiorespiratory and strength. So these are things that you can do from a day-to-day basis. And your quality of life. And so I'm just going to kind of point out a couple of these citations here. Mylene in 2008, she did a study on those who had breast cancer and had two groups. One group, she had those participate in an immediate exercise group where individuals exercised for 12 weeks and immediately after their treatment. And she compared them to another group, which was called a delayed exercise group, and they exercised much later after their treatment. They also participated in a 12-week program. And what was shown was that the immediate exercise group had increased their cardiorespiratory and strength abilities more so rapidly and much larger than those in the delayed exercise group. And Siegel in 2009 also incorporated a cardiorespiratory and strength study. He more so focused on those who had prostate cancer and receiving radiotherapy at the same time. And he incorporated a study where they took a group who either exercised endurance-wise or exercised strength-wise and compared them to those who did not exercise at all. So they followed up with their usual treatment, their usual care. And what they found was that the group that exercised either in the cardiorespiratory or the strength training group, they both improved in their endurance and their strength. Right? And so what was a little bit more interesting as well is that the study found that in the resistance training group, the individuals definitely seen a greater decline of their fatigue, or they improved their fatigue levels. And they also found that their triglycerides improved and their body fat mass, as well as their strength. Regarding physical function, let's talk about Galvo in 2010. This individual and a group of others focused on individuals who were taking androgen suppression therapy. And so if we may or may not know with androgen suppression therapy, this puts a toll to our musculoskeletal system. And what he wanted to see was whether or not exercise had an effect towards these toxicities in the musculoskeletal system. And what he did find was that he had these couple of groups participate in endurance and strength training, and versus a group that did not participate in any exercise at all. And of course, he found that those who were participating in exercise, again, improved in endurance and strength, as well as improved in their 6-meter walk time forward walking and 6-meter walk time walking backwards. And so 6 meter is something that physical therapists or even exercise physiologists use to help determine one's physical function. So this is something that we can use as a baseline to see how you do over time through exercise. So it's important to also know how you feel after and during exercise, but it's also sometimes important to know how we're doing quantitatively so that we may be able to modify your exercises. And we also do coordinate with, or if you were ever to see an exercise professional, it's important for them to coordinate with your oncologist as well, or with yourself or your rehabilitation nurse to know what cycle you're in your treatment if you're undergoing treatment at that time. And so lastly, we'll just mention the quality of life. All of these studies here from Siegel, Mylene, Adamson, Galvo, Campbell have all said to improve your quality of life. But Mustian in 2009 had mentioned how quality of life is definitely affected and associated with cancer-related fatigue, and this is something we had talked about earlier. And what was really nice is that he mentioned that not only are we seeing all these fancy numbers, oh, we're doing great in strength, we're doing great in aerobics, and we're lifting more, or we're using our shoulder a lot more and better, and it's a lot more flexible. But what he mentions is we are getting down to the cellular mechanism and the physiology of the body, and the cellular mechanism somehow rejuvenates itself through exercise. So are we exercising? That's the main question. The results are positive. There are tons more research out there being performed. With your physical function is being improved throughout so many different types of cancers, and that involves endurance and strength and flexibility, range of motion. And in fact, for example, reduction in the risk of cancer recurrence and increased survival rates that have been seen in breast and colorectal cancer populations. But cancer survivors' physical activity levels are thought to decline by at least 1/3 following diagnosis, and listen to this, are often not recovered several years post-treatment. Only 29.6% of cancer survivors are meeting the American Cancer Society's public health ACSM guidelines of 150 minutes of moderate intensity exercise per week. So we mentioned this earlier, about 30 minutes a day. Now, I'm not asking you today, let's go ahead and do 30 minutes on the treadmill or 30 minutes of strength training. We slowly go up and progress to this general guideline. Everyone is different, and we treat everyone differently, and we give them specific guidelines. But these are very general guidelines, and we know that everyone is different. But when we speak about in terms of moderate intensity, what we usually like to ask our clients is, well, how hard do you feel like you're working when you're exercising, when you're performing this particular exercise? And sometimes we use a scale, let's say a scale of 0 to 10. And I would ask, 10 would be the worst case scenario. You are going to crawl out of here, you can't make it out the door. We don't want to be at that end. And 0 would be, this is very easy, I'm falling asleep on you, I'm too bored. We don't want to be at either end of the spectrum. So we'd like to be between the 5 and 6 range. But again, that's going to depend on how you feel that day, where are you at your point of your cycle and your treatment, and how many days after have you recovered from your treatment. So, are we exercising? Why aren't we exercising? There are definitely some barriers and some things we talked about earlier that definitely take into effect. But one of the things I wanted to mention is knowledge of exercise and its benefits. Some individuals do not know the benefits of exercise, especially when they're undergoing treatment or even post-treatment or even thereafter for long term. And it's important to raise these questions and to raise them with your physician, your oncologist, and your exercise professional. And there may be other things that you might be more concerned with. Well, I typically experience fatigue right after treatment. What do you might ask the question of, well, I'm afraid that if I exercise, I'm just going to exacerbate my fatigue. Well, Siegel in 2003 performed a study 3 times a week for 12 weeks. He saw 155 patients who had prostate cancer. I think I lost my screen here. And I know we have to wrap up. Okay. You see it? There it is. Okay. Okay, thank you. I apologize about that. Okay. Okay, And so in general, I know we're running a little bit short on time, but in general, these are some of the concerns that we may have with fatigue or maybe even shoulder. You just had a surgery in your shoulder. You're not sure how quickly or how soon you want to get back into exercising. And but these results here have shown that even with just starting out with an exercise program and going slowly and progressing can help mitigate fatigue, can help get your limbs stronger, or can help with shortness of breath even for those who have or had lung cancer or have developed chronic obstructive pulmonary disease. So the idea is to meet with your physician, and he would want to probably go into an evaluation of your peripheral neuropathies and musculoskeletal morbidities. So just to make sure how your balance is or how your coordination is, if you would need an assistive device or if you need someone to help you go through some activities at home or outside. You may want to talk to your physician about evaluating your risk of fracture or if you have metastatic disease, so if you had a high risk of fracture as well, or if you had any known cardiac conditions. So if you're taking high blood pressure medications, it is very important for the exercise professional to know this to help modify your exercise. And as always, per the ACSM guidelines, there are definitely other criteria that we would look into. And some other things for a little bit more cancer site-specific assessments. For breast cancer, evaluate the arm and shoulder, making sure that the lymphedema is controlled and managed. Prostate cancer, making sure that you evaluate and manage and knowing if there's any loss of muscle strength and wasting. Lung cancer, evaluate how your shortness of breath is. Do you need supplemental oxygen? Colon, if there's any infection prevention education that we need to speak about before going into an exercise program. And gynecological cancer, evaluating lower extremity for lymphedema. So the next few slides are just a general pictures of some exercises that might be important for particular cancer. So this individual is actually pressing her arm out with a TheraBand. You don't necessarily need to use a TheraBand. You can do this on your own if we're not able to do this at this point, but she's working and using her shoulder. For individuals with prostate cancer, it is a general guideline to help strengthen the abdominals and your lower back and your hips. So this person is at the edge of her chair and leaning back with her back straight and coming forward, contracting her abdominals. For lung, it is important to always keep a reminder of diaphragmatic breathing, using your diaphragm and not breathing through the neck. Okay. Some recommendations for exercise, and the goal is to improve physical function, aerobic capacity, strength, flexibility, improve body image and quality of life, and body composition. And this is very important, and this is something you want to speak to your physician and also your exercise professional. Fatigue. These are some things that, some recommendations to look into. Try at least doing 10 minutes a day of some stretching or exercises. At RIC, we provide a home exercise program for our clients in case they're not able to come out and perform any personal training sessions with us. Then we have neuropathy, gait concerns. We want to know if you have neuropathy in your feet or maybe in your hands, and when you're walking, we want to make sure that the surfaces are adaptable to your needs. And then, of course, we spoke about bone health, about fracture risks, edema, shortness of breath. We want to make sure that there aren't any clots that may come up about in your legs. Medications, always update your exercise professional about any medication changes. Radiation, it might not be a good idea to use the pool with chlorine. Catheter Hickman lines, avoid water that may cause infections. Blood counts, do not exercise if you have anemia. If you have anemia, this may exacerbate fatigue. And shoulder health, and we touch base on shoulder health. If you just had shoulder surgery, it is very much so recommended to follow up on your doctor's and physical therapist recommendations. recommendations. And so what now? Through our Restore Fitness Cancer Program, we all want you to meet with your physician, and there is a medical form in your goodie bag. This is just an example of what what an exercise professional may ask of you, what they should ask of you, and what we ask from you. And it provides information for us about your diagnosis, medications, any contraindications, considerations before you go into an exercise program. The next thing is to meet with your exercise professional E. And so with an exercise professional, he or she may go through a cancer history form to go into a little bit more detail about any surgeries or any treatments and what your fitness goals are, or functional goals are. And then lastly, perform your fitness assessment A, which would entail strengthening test, flexibility test, a balance test, endurance test, a lymphedema measurement to make sure that we're okay before we're exercising. But it all depends on what your goals are. And then, of course, we offer the class and personal training sessions based on your assessment and what your preference is. And we include a home-based program for you. So remember the PEA. Eat your peas. They're good for you. We talked about nutrition earlier. And these are some other groups that we kind of highlighted that you've seen today in the booths that are all other extra wonderful resources. Well, I will stick around just a little bit after. If you would like to ask me any questions, please feel free. Thank you for coming.
Thank you, Raquel, and I'm so sorry that we went over time. I know she had a wonderful gentleman that was going to demonstrate some of these great exercises. So please feel free to reach out to Raquel and she can give you some more info. I just want to thank you all for coming. We have the evaluation forms that were on the tables. We really value your feedback. So if you don't mind completing them, they're two-sided.